Welcome to UMCC Medical Consulting Connectors, where your health matters to us. Taeniasis is an infection caused by tapeworms. These tapeworms are flat, segmented worms that can grow to several meters in length. They attach themselves to the walls of the intestines and absorb nutrients from the host. These are parasites that live in the intestines of humans. They can cause a range of symptoms, from mild discomfort to severe digestive issues, depending on the number of worms and the overall health of the infected person. People usually get infected by eating undercooked meat from infected animals. This includes beef and pork that have not been cooked to a safe temperature, allowing the tapeworm larvae to survive and infect the person consuming the meat. Taeniasis is a global health concern, but it is more common in developing countries with poor sanitation. In these areas, the lack of proper waste disposal and hygiene practices increases the risk of infection. The most common types of tapeworms that cause taeniasis are Taenia saginata, also known as the beef tapeworm, and Taenia solium, or the pork tapeworm. Each type of tapeworm has a specific animal host, with Taenia saginata found in cattle and Taenia solium in pigs. These tapeworms have a complex life cycle that involves both humans and animals. The cycle begins when animals consume tapeworm eggs from contaminated food or water. The larvae then develop in the animal's muscles, and humans become infected by eating the undercooked meat. Understanding the life cycle of these parasites is crucial for effective prevention and control measures. By breaking the cycle at various points, such as improving sanitation, cooking meat thoroughly, and educating communities, we can reduce the incidence of taeniasis and protect public health. Humans get taeniasis by consuming raw or undercooked meat that contains tapeworm larvae. This often happens when meat is not cooked to a high enough temperature to kill the parasites. These larvae, known as cysticerci, are typically found in the muscles of infected animals. They can be present in beef, pork, and even fish, depending on the type of tapeworm. When a person eats contaminated meat, the cysticerci mature into adult tapeworms in the intestines. The digestive process does not destroy the larvae, allowing them to thrive and grow. These adult tapeworms can grow to be quite large, sometimes reaching several feet in length. In some cases, they can even cause blockages in the intestines, leading to severe discomfort and health issues. They attach themselves to the intestinal wall and begin producing eggs. These eggs can cause further infection if they spread to other parts of the body. These eggs are then passed in the feces of the infected person, contaminating the environment and potentially infecting other animals or people. This cycle of infection can continue if proper hygiene and cooking practices are not followed, making it crucial to handle and cook meat safely. Many people with taeniasis don't have any noticeable symptoms. However, some people may experience symptoms such as abdominal pain, nausea, weakness, loss of appetite, or weight loss. In some cases, segments of the tapeworm may be visible in the stool. If you experience any of these symptoms, especially if you have consumed raw or undercooked meat, it's essential to see a doctor for diagnosis and treatment. Early detection and treatment are crucial to prevent complications. Section 4. Diagnosing and treating taeniasis. Doctors diagnose taeniasis by examining a stool sample. The sample is checked for the presence of tapeworm eggs or segments. Treatment usually involves taking medication to kill the tapeworm. In addition to medication, your doctor may recommend dietary changes or other lifestyle modifications to support your recovery. It's essential to follow your doctor's instructions carefully and complete the full course of treatment to ensure the infection is completely eliminated. Section 5. Protecting yourself from taeniasis. Taeniasis is an infection caused by tapeworms, which can lead to serious health issues if not properly managed. You can lower your risk of getting taeniasis by following some essential health practices and being mindful of your food sources. One of the most effective ways to prevent taeniasis is to cook meat thoroughly at a safe temperature. This ensures that any tapeworm larvae present in the meat are killed. Always use a food thermometer to check that the meat has reached the recommended internal temperature. This step is crucial in eliminating the risk of infection. Another important preventive measure is to wash your hands well with soap and water after using the toilet and before handling food. Proper hand hygiene is essential in preventing the spread of the parasite. Make sure to dry your hands with a clean towel or use hand sanitizer if soap and water are not available. Keeping your hands clean is a simple yet effective way to protect yourself. In areas where taeniasis is common, it's important to be cautious about the source of your meat. Always buy meat from reputable suppliers who follow proper inspection protocols. Ensure that the meat you purchase has been inspected for parasites. This adds an extra layer of safety and reduces the risk of taeniasis. By taking these precautions, such as cooking meat thoroughly, practicing good hand hygiene, and choosing inspected meat, you can significantly reduce your chances of contracting taeniasis. Stay informed and stay safe.